A'udhu billahi minash shaitwanir rajeem. Bismillahir rahmanir rahim. Respected elders, brothers and sisters, assalamu alaikum. Yeah, so I'm glad that you talked a bit about logic in Islam as well, because I wanted to talk today a bit about something that can relate to my studies and also what I'm interested in, and look more into the future. So I've decided to choose a topic that I think isn't that well understood in our community as a whole, which is mental health. Personally, I find that the image of mental health in our community is a bit skewed and often not well understood at times. And often you hear about things like exorcisms or freeing people of possessions amongst the Islamic community. But I think Islam actually provides Muslims with a code of behaviors, ethics and social values, which helps them in tolerating and developing adaptive coping strategies to deal with stressful life events or to deal with problems that may be seen as mental health issues. So a quote from the Quran, chapter 28, verse 77, "Seek the life to come by means of what God granted you, but do not neglect your rightful share in this world. Do good to others as God has done good to you. Do not seek to spread corruption in the land, for God does not love those who do this." I think there's a lot of quotes like this, which if a Muslim can look at them, and it doesn't have to be just a Muslim, anyone with some kind of faith in this world, if you look at quotes like this, you can kind of build like a guideline or kind of something that you can look to if you ever do feel that you've come under some kind of stress. There's an attachment theory by someone called John Bowlby. So we know that having a secure attachment has been linked to an overall or all-being coping better mental health strategy. So an enhanced self-esteem, a stronger relationship functioning, and thus a healthy attachment to God would also be linked to a better psychosocial functioning. Once again, the Quran, I think, narrates this really nicely in chapter 65, verse 3. And whosoever puts his trust in Allah, then he will suffice him. So again, we can see that Islam has said, you know, if you do ever come under problems in terms of it, not just mental health, but this can be any problem really. If you have that faith and have that trust in Allah, you know, you will receive that trust as well and that faith. So I had a look at some papers as well, some research papers that were published in the Indian Medical Journal of Psychiatry. And researchers have found that Muslims are quite hesitant to seek for mental health professionals in the West, especially due to differences in their beliefs and the culture. And sometimes Muslims might feel uncomfortable in seeking psychiatric help to avoid conflict with some certain beliefs. But I think you have to see that the treatment in psychiatry is very biopsychosocial, as in religion is considered to be one of the most psychosocial factors in human life in our world. So therefore, I want to try to recognize how Islam can actually modify the treatments and prevention of different mental health disorders. The thing is, there's so many mental health disorders I could go through, and we're not going to have enough time to go through all of them. So I'm just going to go through like the model of all kind of mental health disorders, and then talk a bit about depression, as is a major one. So in Islam, religion and spirituality are not mutually exclusive, as you cannot have one without the other, in my opinion. Other religious and spiritual traditions may see them as separate, where you can have one or the other. So from a biological perspective, different studies have found that being religious increases patients' satisfaction and adherence to treatment in many cases. This can be applied to Islam in the way that drug adherence, through encouraging Muslims to look at their health by seeking advice and receiving treatment, is almost considered as a gift from God which should be cherished. On the contrary to what is commonly thought amongst Western societies, that Muslims kind of bought this mental illnesses are due to demons or jinn. It was actually the Europeans in the medieval period who viewed mental illness as a demon-related illness. Whereas actually Muslim scholars of the time, including Ibn Sina, who was actually seen as the father of modern medicine, rejected such concepts and viewed mental health disorders as conditions that were psychologically based. This actually led to the establishment of the first psychiatric ward in Baghdad in Iraq by Al-Razi, one of the greatest Islamic physicians. And this was the first psychiatric hospital of sorts in the world actually. And according to his views, Al-Razi's views, mental disorders were considered medical conditions and were treated by using psychotherapy and drug treatments, rather than what a lot of Islamic people see as a sort of peer or beating someone or using Quranic verses to get a jinn out of someone. Another fact, which is, to be honest, related to all medicine, is the awareness and adherence to psychiatric medication that can be affected during different periods of the year, for example, Ramadan. But again, you can easily adjust, intervals, your dosage, timings, and it shouldn't be something that gets in the way of a Muslim's life, medication like this, because it's always seen as a kind of stigma against it. Someone is taking medication to, what they'll say is keeping them sane, but actually it's just like any other disease, where if you need medication for the disease, it helps you be better or be treated. So the stigma shouldn't exist, in my opinion. And again, in the Quran, where it says, Allah desired for you ease, He desired not hardship for you. So in that case, if you, for example, do miss your fast, or there is something that you miss, for example, your namaz or any other thing, it's all justified if you look in the Quran. So regarding the psychosocial model, there is Islamic counselling as well. And this is essentially where the main role of the Imam would be to provide advice which would be in accordance with Quranic principles and teachings of Prophet Muhammad. And Muslims approach these Islams on counselling for social or mental health issues, all kind of issues, to be honest. But this form of counselling proved to be effective in many countries, actually. Another model of Islamic counselling, which kind of brings you more to the traditional approach that people would see, is a healer as a sheikh or darwish, or depending on where you live, it will change. And this model explains that the illness or personal problems as a possession of a spirit, and the solution is essentially to exercise the spirit through reading the Quran, through prayers, through beating the spirits out of the actual client's body. And despite the support of some studies for the value of traditional healing, many Muslims actually do not believe this to be a form of healing. Personally, I don't believe it to be a form of healing. And would actually see this as an inappropriate form of healing, and even banned in actually some Muslim countries. There is actually evidence to suggest it can help in neurotic symptoms, but in terms of actual mental health cases, there's really not that much research. There is also Sufism is also seen as a model that can help with mental health in many cases, but it's very extensive and not very relevant, so I'm not going to go into it. There's actually a growing interest nowadays in Islamic psychotherapy from Western country perspectives. So in obviously Western countries, when you talk about mental health or psychiatry, you don't look at it from a religious perspective, you look at it from a medical perspective. But there's actually many things. So they've been trialing certain studies where they've used Quranic metaphors, or they've used stories of the Prophet and his traditions, as well as the biographies of the Prophet himself, with Muslim patients. And they've actually have a great amount of success in being able to treat patients with that, and with adjunctive with medication as well. So you don't forget that there's medication there to help people. Because if you see during the kind of the golden era of Islam, the Islamic scholars discussed the concept of psychology, psychiatry, psychotherapy, and their relationship to mental health was a lot better than I think our society is now. For example, I've talked about Al-Razi before, and he actually achieved a lot of success in kind of discovering the definition and the symptoms of mental health. And he's actually entitled it in his book, Al-Mansuridan Al-Tib Al-Ruhani. I haven't read it myself, but I've had a look at some of the footnotes from it. And it's actually amazing to see just how much they actually thought and actually had, it was all obviously their ideas at the time, which now if you look at them are actually really fit to the psychiatric guidelines that you use nowadays to actually treat patients. So, so there are modifications that have been given to therapy nowadays. And I think there's also a lot of group therapy. And I think Abu was saying this as well, where a lot of mental health problems can come from social isolation. And Islam is a kind of a religion where I believe social isolation isn't it shouldn't be a huge problem, because as you know, you're really encouraged to read namaz in a jamaat. You have Friday prayers where you're meant to come together as a community. There's so many opportunities for you to join with your community and see others and you know, be with others. So if you follow this kind of pattern, you shouldn't ever feel that social isolation, in my opinion. And I think that goes for all religious communities as well. All religions have a kind of at least one day where they are supposed to come together, talk together, pray together, etc. So I think a religion can be seen as a very protective factor against any kind of mental health issue. There were problems though. So group therapy can be problematic actually for Muslims, because although in a Western setting it can conflict with a number of Islamic values. For example, some Muslims can feel uncomfortable sharing personal details in a group. I would say some of us might feel uncomfortable, particularly if the member of the opposite gender are present as well. I think less so in our Jamaat, but it can, as you were talking about, in Sunni Jamaats and whatnot. However, the functions of such groups may be enhanced if they're composed of the same gender, and those values are taken into account. And they've actually have done a lot of studies on schizophrenia in Saudi Arabia, which have revealed that these kind of modified cognitive therapies using the Quran and Islam have actually come with either similar or superior results as the traditional therapies that are used in psychiatry. So it's quite positive actually, the research that they have. So just to finish, I just want to touch on depression, as it's one of the major kind of mental health issues. And it's just very brief, but again, there's lots of things in the Quran that can help you if you ever feel, I mean, not if you ever feel depressed, but if you ever feel like you might want to know more about it or might not know enough, essentially. So negative life events are obviously major risk factors for depression. And Islam, I think, plays a really important role in helping Muslims cope with negative life events, helping them both in prevention and then the treatment. So obviously no one's superhuman. Everyone feels negative effects once in a while. And we as Muslims, I think, are really encouraged to resist them with positive thoughts and actions, and to seek, if needed, to seek help. So in the Quran, chapter 94, verses 5 to 6, so verily with every difficulty there is a relief. Verily with every difficulty there is relief. Again, this is like it's reaffirmed, this kind of message. Islam encourages people to stay hopeful. Even if someone has committed the worst sin or faced with some troublesome life event, there's always God's mercy. That message is always given. Allah is the most, He's the most seeing, the most knowing, the most fair. So you can never, from someone who believes in Islam, you'd never feel trapped, I'd say, in that kind of circle that you do feel when you are feeling depressed. And to quote the Quran again, chapter 12, verse 87, and never give up hope of Allah's soothing mercy. Truly no one despairs of Allah's soothing mercy except those who have no faith. And to counter maladaptive thoughts, they're related to hopelessness and feeling overwhelmed with life, as there is no place for despair, because Muslims believe that it's God Himself who is in charge of everything, the all-seeing, the all-knowing. So just to finish on a quote, from the Quran, chapter 65, verses 2 to 3. And for those who fear Allah, He always prepares a way out, and He provides for him from sources he could never have imagined. And if anyone puts his trust in Allah, sufficient is Allah for him. For Allah will surely accomplish His purpose. Verily, for all things has Allah appointed a due proportion. So that's essentially what I wanted to. I just wanted to touch on mental health and be like how Islam can kind of help to explain it. And I hope maybe in the future I can maybe like expand on this and make more different aspects. Thank you very much.